The commonest question by many parents: my child doesn't pass motions daily, and it is commonly found in the kids who are having autism. So does it have exactly the relation with autism? Parents want to know.
Yeah. So first thing what we are discussing now is a constipation. Children with autism have got a lot of issues with constipation. And a constipation क्या करता है? Because of constipation, appetite is poor. Child stands to present like a picky eater. Because of constipation, the child is irritable, anxious. So we have to be worried about that. Because of constipation, उसको नींद अच्छी नहीं लगती. Sleep issues are a big problem in this case. They have got mood changes. The child is not happy. वो जो फीलिंग रहता है, उफ, my tummy is clean, वो फीलिंग ही नहीं मिलता. Because it is not clean, the abdomen is complaining. I am having pain, I am having discomfort. So your child presents with abdominal pain and discomfort. And because of constipation, if you remember the anatomy of the body, the bowels are just behind the bladder where urine is collected. This bowel, which is filled with motion or stools, it is pressing on the bladder, urinary bladder, and that causes frequency of urination and more of a problem with the bedwetting. So this constipation is creating a hell lot of problems. And to the more than that, it adds to the gut issues also. So that what we call it, we are going to discuss about digestion issues are also hampered because the gut movement is not happening. So my first point to remember today is please see to it that we relieve the constipation with whatever way it comes to. Today I am not going to discuss but about the medicines, but okay to use medicines. It is okay to use suppositories. It is okay to clean the motion first and then start treating other issues of the child with autism. So treat gut fast, but can we treat gut with diet? I think Ashwin will be the best person to answer that.
So if the constipation is to be relieved, the two things important is there should be adequate fiber in the diet of the child and there should be plenty of fluids. So when we think of first is the dietary fiber, then it comes from the vegetables, it comes from the fruits, it comes from the roots, that is carrots, beetroot. Especially in the vegetables group, parents prefer green leafy vegetable, it is going to be helpful. Then the next thing, increasing the fluids. The moment we say increase the fluids, parents start increasing the milk, but that is not the truth. Reduce the milk and milk products. And when we say fluids, give water, sarbat, lemon juice, lemon sarbat, and so many things you can give. Then along with that, what parents can give their child is the black raisin, the prunes, and the apricots. They usually help the gut motility. So that is going to help to relieve the constipation. Then the two wonder oils I will mention is the olive oil and the MCT oil to help to relieve the constipation. Along with that, in the seeds group, the important one are the flax seeds. And now one more thing to avoid is the bakery products, which includes a lot of breads, then the different types of biscuits and all those things. So for the parents, the important thing is plenty of fibers from vegetables, fruits, root, plenty of fluids, and avoid milk and milk products and bakery. Simple rules to follow.
Yeah. Here, I think the first question which has popped up, it's asked about the same thing. What about chocolates and wafers? I tell you, potato is one of the constipating agents. That is part one for that, for constipation. But more to that, all these bakery products, wafers, farsan, chocolates, are they helpful to the child? They're not giving any nourishment to the child. So you need to be careful about it. And who brings them home? It is a mother, father, grandmother, grandfather, aunt, atya, mama, maushi, all of our own kids are getting it. So I always tell, the problem with these chocolates and farsans and bakery products is not with the children, it is we. Are we eliminating this? So I request the mothers over here, first stop giving it to the your own husband, stop giving it to your people who are visiting you, your neighbors and all that, and then and only you can reduce it for the child. We'll go ahead with the next problem. So I understood about the importance of constipation. If it is not getting corrected, please visit your pediatrician, talk to the development pediatrician and make it a point that you relieve the constipation as fast as possible. Very important.
Any particular reason for chocolate cravings, sir, in this case?
Yeah, not only keeping autism or constipation per se, chocolate. Why chocolate is very interesting for the children? Part 1, the taste. Part 2, the sugar part of it. And this sugar part and the taste of the chocolate itself, the cocoa, which is the main content of chocolate, is actually constituted with addiction liability to say. Why? Because it gives some stimulation and a high quick stimulation to the brain, and then brain starts getting, oh, this is very good, I want more, and that starts creating that craze. Second part to that, once you get habituated because of this quick increase of sugar and quick getting of those high because of chocolate, it's not high always because of the drugs and narcotics. The chocolate itself gives you high. Chocolate, caffeine, tannin in the tea, all make your brain high. The brain gets energized for a time being, and it again goes down, and brain again now I want to keep myself that energized, and brain asks for more, and that is called as a craving. And to top it that, our advertisement and media industry takes care that it is bombarded in front of the children in a very different and very attractive way, and you fall trapped to that. The third reason for this craving is we parents. हम लोग क्या बोलते हैं, पप्पू पास हो गया, चलो कुछ मीठा हो जाए, and the Cadbury comes in the hand. For us, giving a Cadbury has become a social custom to enjoy or to reward. And actually ये reward कुछ अलग तरीके से होना चाहिए. We are going to discuss chocolates very well, and so we need to counter, we need to substitute, and we are going to come into that point very soon. But before that, let's go through a sequence of events so that you'll understand it better.
So just to add, many times many parents or therapists use chocolate as a reinforcer, but actually this chocolate is giving craving and a lot of problem. So similar looking chocolate to the replacement for the chocolate can be dates, and then it is healthy option for the body.